7 critical nighttime diabetes. Symptoms you need to know right now. Diabetes is one of the most prevalent chronic diseases globally, affecting millions of lives every year. According to the International Diabetes Federation, IDF, in 2021, approximately 537 million adults aged 20 to 79 were living with diabetes, a staggering 1 in 10 adults worldwide. These numbers are projected to rise to 643 million by 2030 and to 783 million by 2045. Alarmingly, diabetes was responsible for 6.7 million deaths in 2021, equating to 1 death every 5 seconds. In the United States, diabetes is a leading cause of mortality. The Centers for Disease Control and Prevention, CDC, reported that diabetes was the 8th leading cause of death in 2021, with 103,294 cases directly attributed to it. The overall mortality rate stood at 30.4 deaths per 100,000 people. Individuals aged 50 and older are particularly vulnerable, as age-related metabolic changes significantly increase the risk of developing diabetes and its complications. Understanding the nighttime symptoms of diabetes is crucial for effective management and prevention of severe complications. Let's delve into the 7 critical nighttime signs every diabetic should be aware of, with actionable insights to manage them effectively. 1. NOCTURIA. NOCTURIA, or frequent nighttime urination, is a common yet disruptive symptom in individuals with diabetes. Elevated blood sugar levels force the kidneys to work overtime to filter and excrete excess glucose through urine. This condition not only interrupts sleep, but also indicates suboptimal blood sugar control. Research shows that nocturia affects sleep quality, leading to daytime fatigue, reduced productivity, and an overall decline in quality of life. It's also linked to an increased risk of cardiovascular events in people with diabetes, making its management even more crucial. Management tips. Monitor and regulate blood sugar levels consistently using continuous glucose monitoring, CGM, systems or regular finger prick tests. Limit fluid intake during the evening, focusing on hydration earlier in the day. Discuss symptoms with a healthcare provider, as persistent nocturia may signal other conditions such as urinary tract infections or bladder dysfunction. Explore dietary changes to lower glycemic loads, which can help stabilize blood sugar levels and reduce the frequency of nocturia. Additionally, studies have shown that incorporating physical activity, even low-impact exercises like walking, can improve glucose metabolism and reduce nighttime urination episodes. For those experiencing severe disruptions, medications targeting overactive bladder symptoms may be considered under medical supervision. 2. Night sweats. Night sweats, characterized by excessive sweating during sleep, often point to nocturnal hypoglycemia, low blood sugar levels. Common triggers include intensive insulin therapy, imbalanced meals, or rigorous evening exercise. Waking up drenched can disrupt rest and indicate dangerously low glucose levels. Chronic night sweats can also exacerbate anxiety, disrupt relationships, and impair the immune system due to poor quality sleep. Addressing the underlying causes is essential to prevent long-term complications. Management tips. Regularly monitor blood sugar, especially before bed, and identify patterns of nocturnal hypoglycemia. Adjust meal timing to include a slow-digesting carbohydrate before bed to stabilize glucose levels. Keep a fast-acting glucose source, such as glucose tablets or juice, bedside for emergencies. Work with a doctor to evaluate and adjust medication dosages if needed. Some emerging therapies focus on hormonal regulation to reduce episodes of nocturnal hypoglycemia. For example, the development of long-acting insulin analogs has shown promise in maintaining stable glucose levels throughout the night. 3. Restless leg syndrome (RLS). Restless leg syndrome is a neurological condition marked by an uncontrollable urge to move the legs, often accompanied by tingling or itching sensations. For diabetics, RLS is commonly linked to peripheral neuropathy, a complication of prolonged high blood sugar levels. The impact of RLS goes beyond physical discomfort. It can lead to chronic insomnia, increased stress, and a diminished ability to manage blood sugar effectively due to disrupted sleep cycles. Management tips. Maintain optimal blood sugar levels to reduce neuropathy. Reduce caffeine and alcohol intake, as both can worsen RLS symptoms. Engage in regular moderate exercise and consider relaxation techniques such as meditation or yoga. Experiment with warm baths, heating pads, or cooling wraps to soothe discomfort before bed. Discuss persistent RLS symptoms with a healthcare provider to explore medication options or advanced treatments. Supplementation with iron or magnesium may also be recommended in cases where deficiencies contribute to RLS. New research suggests that therapies targeting the nervous system, such as transcutaneous electrical nerve stimulation, TANS, may offer relief for diabetic individuals. 4. Sleep apnea. Sleep apnea, a disorder causing interruptions in breathing during sleep, is more prevalent among diabetics, particularly those who are overweight. This condition exacerbates insulin resistance and impairs blood sugar control, creating a vicious cycle of poor sleep and worsening diabetes. Left untreated, sleep apnea can lead to severe complications, including hypertension, heart disease, and stroke. Recognizing and managing this condition is critical for overall health. Management tips. Adopt lifestyle changes such as weight loss and avoiding alcohol or sedatives, which relax airway muscles. Use CPAP, continuous positive airway pressure, machines to keep airways open during sleep. Practice side sleeping to prevent airway blockage. Schedule a sleep study to diagnose and address sleep apnea comprehensively. Recent advances in wearable technology allow for at-home sleep studies, making it easier to identify and manage sleep apnea. Dental devices that adjust jaw positioning can also provide relief for mild to moderate cases. 5. Nighttime hypoglycemia. Low blood sugar levels during sleep or nighttime hypoglycemia can go unnoticed and lead to severe complications, such as seizures or unconsciousness. Symptoms may include night sweats, vivid dreams, or waking up with a headache. Chronic episodes of hypoglycemia can also impair cognitive function, increase anxiety about managing diabetes, and lower overall quality of life. Preventive strategies are key to avoiding these risks. Management tips. Monitor blood sugar levels before bed and consume a carbohydrate-rich snack if needed. Adjust medication timings or dosages under a doctor's guidance to prevent nocturnal dips. Educate family members about recognizing severe hypoglycemia and administering emergency treatments such as glucagon injections. Consider using CGM devices with alarms to alert you to dangerously low glucose levels during sleep. Emerging therapies, such as dual hormone insulin pumps that deliver both insulin and glucagon, are gaining traction as a preventive measure against severe hypoglycemia. These systems provide an additional layer of safety for individuals prone to nocturnal episodes. 6. Nighttime frequent thirst. Excessive thirst at night, often caused by elevated blood sugar levels, is another common symptom. High glucose levels draw water from cells, prompting increased urination and subsequent dehydration. Prolonged periods of nighttime thirst can lead to dehydration, which exacerbates blood sugar imbalances, reduces energy levels, and increases the risk of kidney complications. Management tips. Keep blood sugar levels in check through regular monitoring and medication adjustments. Balance fluid intake throughout the day, avoiding large amounts in the evening. Limit caffeine and alcohol consumption, as both can act as diuretics and disrupt hydration levels. Explore electrolyte solutions or natural hydration boosters to maintain balance without overloading on water at night. New research suggests that incorporating plant-based hydration aids such as coconut water or aloe vera juice may improve hydration levels without contributing to excessive sugar intake. 7. Nighttime cramps. Painful muscle cramps, particularly in the legs, can stem from blood sugar imbalances, reduced circulation, or diabetic neuropathy. These sudden contractions can disrupt sleep and indicate poorly managed diabetes. Recurring nighttime cramps can also cause lingering muscle soreness, decrease mobility, and contribute to stress or anxiety about sleep. Addressing the root causes is essential to improve overall comfort and health. Management tips. Stretch before bedtime, focusing on the calf muscles and other commonly affected areas. Stay hydrated and ensure adequate intake of magnesium and potassium through diet or supplements. Use heating pads or warm baths to relax muscles and improve circulation. Discuss persistent or severe cramps with a healthcare provider to rule out underlying vascular or neurological issues. Recent innovations in wearable devices that stimulate muscle relaxation during sleep show promise in managing cramps effectively. These tools can be particularly helpful for older adults experiencing frequent episodes. Conclusion: recognizing and addressing these 7 nighttime signs is vital for effective diabetes management, particularly for individuals aged 50 and older. By staying vigilant, making informed lifestyle adjustments, and consulting healthcare professionals, diabetics can improve their sleep quality and overall well-being. These nighttime symptoms are not just signals of underlying issues, but opportunities to optimize health and prevent complications. Over 90% of people watching this video haven't subscribed yet. Help someone you care about see the world more clearly by subscribing today. And if you're ready to dive deeper into the world of natural wellness, our next video awaits. Click through to continue your journey toward vibrant health. Thank you for watching, and we look forward to having you join us in the next one.